The next case is one of a case of a clinical study which we did a couple of years ago, and we focus on this issue in the future on immediate occlusal loading and simultaneous sinus lift procedures. I'd like to present you one of the first cases, the window preparation. We place 6 implants here in this maxilla. 2 of the implants, I just show you a little bit in this area. You can see that one of the implants is visible, the other one is exactly in that area. We placed 2 implants in the sinus. At the same time, we augmented the sinus after the sinus membrane elevation with autogenous bone particulated from the tuberosity and the residual ridges. The implants have been splintered together, as you see in the last picture of the screen, with the temporization. This temporization is cemented with Tembond, and this patient certainly has to use soft liquid diet for the next 3 to 4 months. It's important after 3 to 4 months to evaluate the stability of the implants, and you see here in this particular case, before I remove the restoration, the provisional restoration, 3 months after the surgery, 1 Panorex is sufficient, is enough in order to see the bone quality I get around this particularly implants which has been placed in combination with the sinus lift procedure. If you compare the pre-op situation at the left side of the screen compared to the immediate after surgery Panorex, the autogenous bone is not radiologically dense in order to see very well in the Panorex the augmentation procedure, but 3 months later you see that we have a new remodeling because of the immobilization, because of this particular implant design, which is progressive thread design in the apical part, and then of course because of the soft liquid diet. Here, after 4 years, the same case shows to you very nicely that even the autogenous bone in the area of the sinus changes in a positive way in the density, and you have around the 2 apical parts of the implants a very nice dense bone and good quality. Even the implants have been placed and loaded immediately after surgery. Let's go a little bit deeper. I'd like a little bit to focus on this more stable connection with 6 degrees angulation, which is actually mechanically a very stable connection. And you see that the advantage of this system is also that the patient, the surgeon is able to place the abutments, or in cooperation with the restorative dentist or the prosthodontist, to place the abutments in the days of the surgery. We have the opportunities to use 360 options of angulations because we don't have here any hexagon or octagon, and then immediately after that to load the implants. The implants here specifically, you see, they have the abutments have been immobilized with special ratchet for this particular system. 15 Newton centimeter is sufficient to have a good engagement for final torque, in other words, with the abutment on the implant, and then later on we do a temporization actually straight away in occlusion with the lower jaw. Conical sealing means for me a virtual one-piece implant with a big advantage compared to other systems, that we don't need to bend anymore the abutment and to have risk of failure or fracture, but we have the opportunity using this kind of abutment connection to change the angulation with different various degrees we have in order to have the advantage to place implants in the maxilla or in areas where we have to use angulations, and also to load the implants immediately. The second group of patients is from a retrospective data from the NYU. A group of patients, 11 patients in this particular group. 8 implants have been placed in the maxilla from my residents and myself in the University in New York at the NYU, the Department of Periodontology and Implant Dentistry. The same implant system has been used. The difference here in this particular group of patients is that, as I mentioned before, one group of the implants in the same patient have been placed by the residents, and the other group by myself, which is, in other words, we have a different actually level of experience between the two groups of clinicians. I'd like to present you here a couple of cases: weak bone quality in the maxilla with simultaneous bone spreading procedure. In this particular case, immediately after that, the abutment connection, certainly angulated abutments, have to be placed here in order to have the immediate loading in the maxilla. And immediately after surgery, we do a chairside temporization. Even my students here were able to do chairside temporization in an easy way, and you see the Panorex immediately after the surgery. But also the same patient 1.5 years after loading in the maxilla, and the mandible was in a similar way. We have stability of the crestal bone. The next case shows immediate functional occlusal loading and simultaneous bilateral sinus lift procedure. We extracted teeth, and in the same time we placed here immediate implants in the sockets. We augmented with particulated bone grafting material. Here is, for example, the Pyrrhus, and also from the company Zimmer. And also we used the Baumet Extend to cover the window, because I like this membrane because it's very has a very good stability. We can also mobilize if we need. It has a good stiffness. We can immobilize the membrane using tacks. I like to use the Frios tacks by Fried and Dansply, but we can also use other tacks, but I prefer the immobilization all the time using tacks for security of my graft. In the other side, in the contralateral side, similar process. We use the same grafting material in that case. In other cases, we use this also from Osterhof or Geistlich in Europe, and we have a predictive result of the time. I'd like to share with you the implants in place. Immediately after that, we remove the inserts, and we go straight away to finish the case with the same kind of abutments like in the previous case, which are the standard abutments, which are placed by the clinician, by the residents here, in a very easy way. We do not have problems with the parallelity at all, and we don't need to be certified prosthodontists in order to parallelize thin abutments, because we have the opportunity to parallelize with different angulations because of this advantage of this particular system with this conical implant abutment connection. You see immediately after surgery the temporization in occlusion, and last but not least, the post-op radiographical examination shows the bone level, and also the same patient after 1 year shows excellent crestal bone level, stability, and increase of the density of the particulated bone grafting material compared to the previous radiographical evaluation. Why? Because we load the implants. And anytime we load the implants, we load the particulated bone grafting material, which is here in combination actually with a little bit autogenous bone from the tuberosities and from both sides of the maxilla. We accelerate the wound healing process and the remodeling process in the interface around the implants. Finally, as a scientist, I'd like not only to show some cases and to provide materials and products, I'd like to show scientifically in a long term what happens to these two groups of patients. From my group, 15 patients, University of Frankfurt, 90 implants, compared to the group of NYU with my residents, 11 patients, 88 ankylosing implants, placed in the same day with the same procedure, with the same mentor if you want, with different actually labs, not the same lab in the university clinic, but different clinics, different labs in the Manhattan area. We had the opportunity to select 11 in these patients to do simultaneous sinus lift procedures in 11 cases and 30 augmentations simultaneously with immediate functional occlusal loading. The loading period in the first group was almost 43 months, and this represents success rate 96%. In the other group of the student group with myself, we have here particularly success rate of 98% in a load period of almost 1 year. Of course, we focus on this level in the next years, and like in the future probably to be able to present to Dental XP the long-term results after maybe 10 years and more with the two groups. In overall, we have, in other words, in a loading period of more than 2 years, a total success rate with this concept without to remove the abutments anymore, and based on the animal studies, as a total success rate of 97% in a number of implants of 178 with simultaneous augmentations or in compromised bone qualities. Finally, one of the cases where we have advanced periodontal destruction, where we have poor bone quality, maxilla and also mandible with simultaneous augmentations, I'd like to present you the concept where we go today, especially if we do not have any high smile line, but in moderate or low smile lines, we have the opportunity to extract the teeth, to augment the sides, and at the same time to place immediate implants. And here I like to present in a more provocative way the lower jaw. If we have the opportunity to make computerized technology, which we need today for special cases, certainly, we need to open the flaps sometimes, like you see here, in order to see where the implant comes after the insertion, in order to avoid to have exposed threads and to be sure, in other words, that these areas will be augmented. We augmented in this particular case with autogenous bone in order to improve the remodeling process during the immediate loading period based on our protocol, but we can do also as a sandwich technique if we need much more bone to use autogenous bone in contact with the threads, with the titanium surface, and immediately after this condensation within the threads of the particulated autogenous bone grafting material, we use also other grafting materials. I prefer actually the Cancellous Bios by OsteoHealth with the high pores, and the Cancellous with the big pores, or we use also other particulated grafts, like for example the Pyros in the Cancellous form. The implants immediately after the augmentations have been immobilized together after the abutment connection. Here the standard angulated abutments, and last but not least, you see here after 2 years the final result, which here has been done in the University of Frankfurt with one of our master technicians of the lab. And you see also that if you remove now the final restoration, which is here, which is cemented restoration, we have an excellent soft tissue healing, and also the bone level seems to be very stable after 2 years. Even the bone grows over the platform because of exactly this concept of the immediate placement, augmentation, immobilization, soft liquid diet, and a little bit subcrestal placement of the implant platform. And this is exactly now the same case after 5 years. Don't forget, I don't like to present here to Dental XP short-term healing after 5 years. Where is the bone level in the maxilla and also in the mandible in these compromised bone qualities? Conclusions to this presentation: the immediate functional or occlusal loading in the maxilla, or also in cases and patient groups with compromised bone qualities, can be successful if we achieve an initial primary implant stability, if we are able to have a cross-arch immobilization, and last but not least, if we use a soft liquid diet protocol for the first 3 to 4 weeks, or sometimes, especially in the sinus lift area, when we do immediate loading 3 to 4 months after surgery. Certainly, further research with different implant systems is necessary in order to evaluate the long-term clinical outcome in these treatment protocols using also different grafting materials. With these words, I'd like to thank you for the invitation, Dental XP. I'd like to thank David Garber, Maurice Henry for this opportunity, and I wish to all of us to use this kind of treatment in the future in order to improve a better quality of for our patients. Thank you very much.